that asking very consistent question. If I'm taking medication, weight management medication, will I be able to come off those medications when I reach my ideal weight? Is it possibility?
So yes, it's an exceedingly common question that I hear from our patients. The answer is kind of broad and a little bit complicated. So let me break things down a little bit. So lifestyle in terms of diet and nutrition, exercise, physical activity, sleep, managing stress, and so forth are very, very important no matter whether you're taking medication or not. The medications are always supposed to be what we call an adjunct to the lifestyle changes that every patient should be trying to do regardless. And part of the reason for this is if you're not in the habit of eating properly, exercising, and getting good sleep and managing your stress and so forth, while you're taking the medicine, yes, the medicines can be powerful and some people can induce significant weight loss, but it's been shown that whenever you lose a significant amount of weight, regardless of whether you do it only through lifestyle or with medicine, your resting metabolic rate when you reach your lower weight is actually lower than it used to be before you gained the weight. And I'll give you an example. People are probably familiar with the television show The Biggest Loser, where people lost significant amounts of weight without medication. It's very, very intensive lifestyle, really restrictive, low-calorie diets. Almost everybody lost a tremendous amount of weight. These people were very, very elevated BMI when they started. Almost all of them gained the weight back. And they were not using any medicines at that time. This was all with lifestyle. The reason that they gain it back is a few factors. So that resting metabolic rate, how many calories you burn when you're not doing anything, lying in bed, asleep, that never bounces back. We don't entirely understand why that is, but this is why yo-yo dieting, gain it, lose it, gain it, and so forth, is so unhealthy, is because each time that cycle goes through, the resting metabolic rate is lower every time. So you have that working against you. Your body doesn't have as many cells and as much mass to provide energy to once you lose the weight. So your resting metabolic rate is actually lower. And also there are hormonal changes. I'll try to be kind of brief in general about them, but think about two hormones, one for hunger that's called ghrelin, and one called leptin that is supposed to tell your brain and your gut that you're full. Ghrelin is always turned on whenever you it's time for a meal or you have lost weight. It's a natural hormone to help regulate your weight. So if you're starving and there's a famine, you're going to go searching for food because this hormone level is high. Leptin is made by fat cells, by adipose tissue, and it goes up when you become very heavy because that's, as you gain weight, it's supposed to be telling your hypothalamus, your brain, that we don't need to eat as much. We've gained enough weight here. But something happens when people become far heavier. It's called leptin resistance. The brain doesn't respond to that high leptin signal anymore, but as soon as they start to lose weight, the ghrelin gets turned on. So you have high hunger hormone and you have the brain not listening to the satiety hormone, the I'm full hormone called leptin. So if you have leptin resistance, you lose a lot of weight either with medicine or with lifestyle. When you want to go off the medicine or maybe not be so strict about your diet and exercise and so forth, you want to back off on the treatment, and you've lost weight, ghrelin is high, leptin isn't being heard, and it's going to cause you to be very hungry and you're going to be more likely to gain that weight back. So if you're on a medicine like Wegovy or Zepbound to lose weight, and you do lose a significant amount of weight on the medicine and you'd like to think about coming off, first of all, we're not going to go cold turkey. We're not going to take you off the medicine immediately. You'll get GI side effects and also more likely to start gaining weight. we would probably cut the dose in half, something like that, and see how it goes, because we don't want that yo-yo, that sine wave to start going on. But also, there are a fraction of people, there was a study done with Zepbound, where after 1 year, both arms of the study were on the original medicine, the real medicine, were being treated with Zepbound for a year, and then one arm of the group went to placebo, and the other one kept on getting the Zepbound. Most of the people in the placebo group started to gain weight back. There was a small percentage who did not, maybe 10%, 15%, something like this. But most of the people gained at least 50% of the weight back. So long story, very long story, maybe short. If you don't have all those lifestyle changes in place, if you haven't made those good habits, then you're unlikely to be able to prevent the weight gain. And in order to really maintain your new weight, your weight goal that you reached, is going to require very vigorous exercise. It's been shown in order to really maintain that weight, whether you lost it with lifestyle or medicine, probably an hour of vigorous exercise pretty much per day, or at least 6 days a week, in addition to healthy diet that doesn't have too many carbs and too much saturated fat, whichever diet you happen to like in that regard. But basically, you're going to have to be very strict with yourself. You're going to need to exercise quite a bit and eat very healthy if you want to maintain your weight loss. And this is why I tell people that exercise is very important for cardiovascular health, but in terms of weight loss, the calories in is much more important, the diet and so forth. But in terms of maintaining weight, weight maintenance we call it, exercise becomes really, really important, and it's got to be vigorous. There's got to be weight training. You're talking about 300 or more minutes of vigorous exercise every week, breaking that down however you'd like to. So yes, it can be done. People can go off these medicines. A very small percentage might be lucky and not gain much weight back after going off their Wegovy, their Zepbound, and so forth. But everybody else, is going to really have to work at it. And so that's why the medicines should always be adjunctive. They should be used in addition to very healthy lifestyle. If you're doing that all along, you're going to be much more likely to be successful at maintaining your goal weight after the medicines are no longer being used.
Thank you, Dr. Berger.
My pleasure. And if you'd like more information, please feel free to peruse our website at northeastmedicalpractice.com or to call our office to make an appointment. We are located in Great Neck, New York on Long Island, 516-604-3418. Thank you.
Thank you.